In this unit, we will talk about science, technology, and ethics, and we will refer especially to medicine and the moral challenges that it implies. Science and technology are two different areas. Science tries to understand how the world is. That's, for example, what physicists do when they try to explain why the sun shines. Technology, on the other hand, tries to invent machines, objects that help us. For example, when engineers invent a new car. Nowadays, science and technology are together, so we talk about technoscience. For example, that's what happens in medicine. Medicine today has evolved so much that it has created a new area of research called biomedicine. That's the use of live cells for scientific and technological purposes. But not everything that we can do in science and technology is positive and good. That's why we must establish limits to what scientists and engineers can do. Let me give you an example. Imagine a doctor has invented a new medicine and wants to try it on his patients. So he uses it without informing them. Of course, this is unethical, immoral. This shouldn't be ever done. This should be forbidden. That's why we must establish limits. And when I talk about limits, I refer to both legal limits and moral limits. Legal limits imply that we should pass a legislation that determines what is forbidden, what kind of actions must never be done in science and technology, so that we can punish people who break this law. But there must also be moral limits, meaning that every individual should be aware of what is correct and incorrect and should stop doing what is morally incorrect. One very interesting case that shows us the connection between science, technology, and ethics is a moral dilemma. A moral dilemma is a difficult situation when we have to decide between two possible options. Both options are difficult, both options have disadvantages, so it's not easy to decide what is the best thing to do. Let me give you an example taken again from medicine. Imagine we have a patient that's very ill because he's suffering a strange disease. If we don't do anything, he may die. So the doctors are trying a new surgery with him. They have invented a new procedure. They can try to operate this patient, but there is a high risk that the patient dies in the operation. Should the doctors operate him or not? If we don't operate the patient, he might die because of the disease. If we operate him, he might also die because of the operation. So it's tricky. It's not easy to decide what is the best option. What would you do? Here is where medical ethics can help us. Medical ethics tries to give us some clues in order to decide what's the best thing to do in cases like this. Medical ethics is based on four basic principles: the principle of autonomy, the principle of beneficence, the principle of non-maleficence, and the principle of justice. The principle of autonomy means that the patient has to approve, to accept, to give permission to all the things doctors are doing there. The principle of beneficence means that everything doctors do must be used to help the patient. The principle of non-maleficence means that doctors should never do anything that could harm the patient. We must avoid harm. And the fourth principle, the principle of justice, means that we must treat all patients fairly and also treat each individual case separately, taking into account the peculiar circumstances of every individual.